I am visiting today at Stone Oak Women's Center in San Antonio, Texas, in the Stone Oak community, and I have the pleasure to be visiting with Dr. Michelle Harden, and then also board certified Katy Clayton, board certified nutritionist, excuse me.
Yeah.
So, and again, I just want to thank you for your time. I know y'all have been busy all day, but we're just excited to be able to have you and get some great information. So for those that are watching, just to, I know that some may be looking for a new doctor, maybe some place where they can get some good health care. So I would love to be able to just tell people more about what you do. Tell us, how long have you been here in the Stone Oak community?
Well, Gina, first of all, we really appreciate you having us. Stone Oak Women's Center started in 2008.
Okay.
And then we moved out to this area, I believe, in 2015. And we were connected to Stone Oak Methodist Hospital. And then we've been in this center here, right near Baptist Hospital, since 2018.
Okay, quite some time.
So we've kind of moved around a little bit.
So, Katy, have y'all been together that long?
Yes, I've been working with her for 17 years.
Yes,
Wow.
yes. So we work very well together.
That's great, great.
Right.
So what makes your practice, let's say, different than, let's say, the traditional medical office?
Well, I think it's just the concept of slowing down and seeing less patients on a day-to-day basis. Mm-hmm. We've moved from an insurance-based practice in 2024 to a concierge cash-based practice. So it allows us the luxury of seeing less patients and spending more time with patients and just getting to know well, I wouldn't really say getting to know patients well, because I've had patients that I've had for 30 years and I know them very, very well. But getting to know new patients and spending more time with established patients to talk more about overall health issues, so more of a comprehensive women's care rather than the kind of like the routine GYN annual, breast exam, pelvic exam. We really touch on whatever is bothering a patient from the whatever system it is.
Okay. Did you want to add to that?
Yeah, I think it's easy to, well, it's not easy, but it's very common in a fast, rushed practice to look at a woman as a collection of her symptoms. Mm-hmm. But when you have more time, you're able to look at those symptoms in the context of her story, her history, her lifestyle, her genetic blueprint, her movement, her sleep, and all of those things. And that allows you to really put it together and to target it from multiple different angles. So you can see resolution to get her to feeling optimal and vital.
So when someone comes to see you, then they get both of you? Is that right? Or how does that work?
Well, in our lifestyle program, we work together with the patient. But no, when you come for like your comprehensive annual exam, that would be with me. If you have certain issues like gut issues, weight loss issues, and you want to deal with things more from a nutritional standpoint, then you would make an appointment with Katy. If you're interested in doing your genetic blueprint, then I would take the initial history, and then they would meet with Katy to review their genetics and look at it from a lifestyle and supplementation program and from a preventive standpoint.
Okay. So your practice is called concierge, is that correct?
Well, it's a concierge practice, but it's not just concierge patients. So we see patients, some patients come in just once a year. Other patients come in on a monthly basis, a weekly basis. We have different options for different individuals and whatever their needs are. So for instance, today I saw a new patient, and she was a young woman, 19 years old, and she had sleep issues, gut issues, hormone issues.
Wow.
And we were 19. Really, and she came in for her well woman exam. So it was a longer visit, it was about 50 minutes, but we really were able to at least address each one of those issues by looking at the 5 pillars of health. But that took 55 minutes, right? Whereas before, when you came in for your annual, there's no way that I could address all of those because I would have many more patients waiting in the waiting room. So really, in all fairness, I think many doctors want to cover all these issues, but you just don't have the time to do it. So it's having to take that different track and walk away from the mainstream medicine in order to offer this to the patients that are looking for this type of medicine. Not everyone's looking for this.
Okay.
And we do look to make it a different experience than your conventional practice. When you come in, the waiting room isn't full of people. It's you and maybe one other person. We offer the red light therapy, the sound therapy. They get offered a pot of tea.
Ooh, I like that.
We should have offered you some tea today, okay?
It's a relaxing experience is our goal. We spend a lot of time on patient education. You know, it's easy to, for example, tell your child, here's how you do the math problem. But when you explain, you know, how that applies to their life and why they need to know math and getting them really involved in the process. It's the same thing for our patients. We want them to understand their genetic blueprint, how their body interacts and reacts to certain foods, to inflammation, to sleep, how they can recover faster or not based on their genetics. And when you understand that, it becomes more than just a diet I have to follow. It's understanding how this food is reacting with your body. And so
everybody is different.
Everybody's different, right? There's no protocol. And that's why it takes so much more time.
Awesome. So what would be something else that people might be surprised to learn about what y'all do?
Well, I think when you come in when you go to a gynecology office, right, you're thinking about just getting a pap smear. But really, if you look at the number one cause of death in women, it's really cardiovascular health, right? So it's really addressing even, you know, young women that come in at the age of 18 and 20, we do a limited cardiovascular risk analysis because it doesn't start when you're 40 or 50. It starts really in childhood. Right? So just, and I think that you really have a younger generation who is really into prevention and they want to age differently and live differently. I think they actually are looking for more balance in their lives than the generations, you know, behind them.
Did you want to add anything to that?
Yeah, I think, like she said, they're coming into a gynecology office, so they aren't expecting somebody to say, hey, listen, food is information. And when you eat this way, it can actually turn on the expression of unwanted genes or activate genes that we do want to be expressed. And so when they understand that, and we offer body analysis testing. So, you know, patients can go on vacation, come back, and see what that did to their body. And a lot of times they're trying really hard to make good choices and they have the testing done and they go, you know what, I did okay. And it's just reassurance that the choices they're making are translating into applicable change in their body and how they feel.
Okay.
Yeah.
And what would you say is your ideal patient?
Well, I mean,
when I say that, you know,
so our philosophy, I think, is really, it's a physician-patient or patient-nutritionist interaction, right? It's a partnership. So you think about a doctor as someone who's going to fix you, right? You can't do that, even in conventional medicine, right? So it really does take the part of the patient to say, look, I do want to make these changes. I mean, change is hard. It causes conflict, right? And we're not comfortable with that conflict. So it's really that people who want that partnership. Now, I have many patients who don't want a partnership. They just want to come in and have their exam, and we do that too from a preventive standpoint. So I think that what's important is, you know, really giving the patient what they're looking for. And that goes back to that individual person.
My ideal patient is somebody who, you know, before they're sick. You think about seeing a doctor or seeing a nutritionist when you're unwell. But what about when you're well? And you have the time and the resources to up your game, to make changes so that you're now feeling optimal. So even a healthy individual is a good fit for our practice because our goal is to help people live the longest health span possible, right? And when you look at somebody's genetic blueprint, they say you can prevent the onset of disease 8 to 10 years before it ever occurs by understanding what you may be predisposed to and then making the lifestyle changes to downregulate the expression of those genes. So preventative care is where I'm very passionate about.
Okay, and tell me a little bit about your book. I know that y'all have a book on Amazon.
Yes.
So tell us a little bit about
Right
that,
there.
and I will go ahead and grab it.
It's called To Finding Healthy. It's 429 pages, so it's got a lot of information. You can pick it up from any chapter. You don't have to start from the beginning. It's a very easy read. It's evidence-based, so everything in there is backed by science. We try to make it informative, educational. It's got a lot of recipes, pictures, resources. It's a
That's
great
great.
book. We enjoy it.
Oh, that's good. Well, so this was just, when did you release this?
Was it?
October of 2024?
Yeah.
October
Wow.
2024.
Okay.
Yep.
So we'll also put this information so people can find it.
Yeah.
So,
Okay.
is there anything else that you would like to add before we?
I think that, just the getting the word out that there is a different option for women nowadays to come in and get comprehensive women's care in one facility is something, and create and continue that physician-patient relationship is something that's available.
Okay.
Yeah, and women are the caretakers of their family, the caretakers of society, and we want them to know that there's somebody to help take care of them. And that's our goal, is to help empower women so that they can create change within their families and their communities.
I love it.
Yeah.
Okay.
One family at a time, right?
One family at a time.
Yes.
Well, I want to say thank you so much for your time, and I want to thank y'all for watching. We'll display the information if you would like to go ahead and get some more information or set an appointment. And thank you. Bye-bye.
Thank you.